What's up everyone? Dr. Tony Crone here, back for Wellness Wednesday, episode number 14. So today we're getting a little case specific and we are going over temporomandibular joint dysfunction, otherwise known as TMD, sorry. So the main thing that I want to get across is, yes, we treat jaw issues here in the office. We actually have a few patients right now that we're working on and they're having great results. Coming in, whether it's pain, clicking or popping, or just issues with the jaw itself. If you notice any deviation when you're opening, we can definitely help you out here. We have the training, we know what we're doing, because we're just gonna watch and assess and figure out what the underlying cause is that's giving you that jaw pain. Okay, so a couple reasons why you may be having that jaw pain is either trauma or just everyday stressors in life. Okay, so trauma being you take an elbow or some sort of direct injury to the jaw where that causes a shift or some sort of structural issue, which we can address, and if we need to, we can refer out if it's something super traumatic. But a lot of times it just affects the jaw itself with that massive trauma. The other thing, like I said, is just the everyday stressors in life that ultimately give us muscular tension around the jaw. So one of the main questions that we always ask people when they come in with jaw pain is, do you clench? Okay, so it's stressful life. We tend to lock ourselves down and the jaw comes with it, okay? So every time we clench, we're activating these big muscles on the sides of our cheeks here. And when we're holding tension in the jaw, those muscles itself, it limits motion or causes our jaw to deviate, which may lead to the clicking and popping. Okay, so a lot of times it's also that one-sided issue, which again, it causes that deviation. Okay, so we gotta find those stressors in your life that we can teach you to get away from that clenching, because when you clench during the day, more times than not, we clench at night too. So if we can address the daytime stressors, the nighttime is gonna come. Now, a lot of people also ask, do we need a mouth guard to work with this? The answer is maybe, but a lot of times we can address the muscular component, change the dynamics of how we move our jaw, and we don't even need that mouth guard. But like I said, maybe there's times when we do need the mouth guard, and we're gonna work with a local dentist just to co-manage the case to make sure that you're getting out of pain if you have that and we're improving the function. We have tons of different things that we can do in the office to help. Like I said, it's just addressing the muscular imbalances from each side. So whether it's a lot of manual therapy work, as well as dry needling, laser helps, anything that addresses that muscular component so we can change how we open the jaw and decrease that resting tension, because our muscles don't like that. Now there are times when the jaw itself, so we have a disc that sits in between our jaw and the skull that can be the pain culprit also. So we have a specific test that we can do to rule that out, but a lot of times that disc, it shifts, which limits our mouth opening, and it's innervated by nerves in this back part of it. So that's where that pain that you feel is coming from if we're loading that structure there. Okay, so we can do stuff just to reset the system, reteach you how to open, give you some movements to do at home so we can knock this out of the ballpark and get you out of pain, because no one should be living with jaw pain or that clicking or popping, okay? So 2 take-homes that I want you to do if you have this or to may prevent future TMD issues. One is ditching the gum, okay? Gum is not the best for you. Yeah, it gives you good smelling breath, it cleans out the teeth after eating, but that's thousands of times a day that we're activating those jaw muscles by chewing with our mouth, okay? So if we can ditch the gum and switch to something like mints or mouthwash, that can take care of that mouth smell, and it's just not good for those muscles to do that repetitive strain every day. The other thing I'm gonna give you, and I can't give you everything because there's just a lot of stuff that we need to be able to feel and address, but the other one is just from here on out is resting position of the jaw, kind of like belly breathing to stabilize our spine and decrease tension here. But resting position of the jaw is teeth apart, lips together, and tongue on the roof of the mouth. You physically cannot clench your teeth and activate those muscles. So whenever you're doing things like getting ready in the morning, cutting vegetables, you name it that causes you to clench, if you think about that rest position, you won't be able to clench, and you'll notice kind of some decreased tension with that. Now, if all else fails and you don't have any relief, or you may have TMD issues that needs further addressing, we absolutely can help you in here, or if a local chiropractor in your town can definitely help, and we want to help you guys, okay? So if you or anyone you know has any jaw issues, jaw pain, send them our way, because we'd love to help them get out of pain and functioning a lot better. With that, have a great Wednesday, and we'll see you next week for another case-specific Wellness Wednesday. See ya.